Good afternoon, everyone. This is Mayor Nick Hunter and filming this conversation in the afternoon of August the 24th and speaking with a friend of mine, Dr. Carl Nabours, who's been a physician here in Lake Charles for many years. Dr. Nabours, thanks for joining. And why don't we start off, if you would, just introduce yourself and give a little background.
Okay, well, as you mentioned, my name is Carl Nabours, and I graduated from LSU Medical School in 1978, and then I completed a residency in family practice, and I've been in private practice here in town for 40 years.
Dr. Nabours, I'm sorry if this is a little on the nose or a little blunt, but I've known you for many years. You and I have had a lot of conversations over the years. I know you to be a little bit of a conservative gentleman, maybe even a little healthy suspicion of government. Is that a fair statement?
That's a very fair statement, Nick.
Okay, good deal. Dr. Nabours, I'd like to get right into it. If you have a patient come into your office today and they're on the fence about the COVID-19 vaccine, what do you say to them?
Well, first of all, unfortunately, I'm seeing way too many patients that are either on the fence or not even considering getting on the fence that are just refusing to be vaccinated. And I talk to them in the strongest terms I can come up with to try to convince them that it's in their best interest to take the vaccination, as well as, in my opinion, a civic duty to not only their families, but other people that are surrounding them. That if we're going to stop this pandemic, it's going to require everybody getting on board to defeat this virus.
If they say to you, I'm concerned that it hasn't been studied enough, I don't think it's safe, any further comments you would offer?
Well, sometimes I get a little sarcastic and I have to ask them, so well, how many millions of people have to be vaccinated and how long does this vaccine have to be out before you'll be satisfied? And the truth is, those people really don't know the answer to those questions. That's something that's left for the people who actually do research for a living. And the general public is, in my opinion, not qualified to tell me, well, how long does that vaccine have to be on the market or how many millions of people have to be vaccinated? The truth is that there have been, as you well know, millions and millions of people in this country. The last I heard, and that was an old statistic a few weeks ago, over 160 million people have been vaccinated. If there was any serious problems with these vaccines, we'd know about it long before now.
Dr. Nabours, again, I apologize for the bluntness of this question, but I'm just going to ask it. Do you have any financial incentive to promote the vaccine?
Absolutely none, Nick. And I will tell you, I don't know of any doctor or hospital or any other medically related facility that has any vested financial interest in giving these vaccines.
Any incentive to promote exaggerations or promote a scenario that's not reality with what hospitals are going through with COVID-19?
The only interest that I'm aware of, the only incentive is in the public interest to defeat this tragic virus that's killing people and disabling others. And that's more than enough incentive as far as I'm concerned. But again, I'm not aware of any financial interest.
Dr. Nabours, you mentioned what you're saying to patients. Do you visit with fellow doctors locally? Are you hearing of local peers of yours who are suggesting the opposite, that people not get the vaccine?
I'm not aware of anybody in our area who's doing what I consider to be foolish, which would be to recommend people not use the vaccine. I've heard isolated reports of isolated doctors in certain areas, but nobody locally that I've heard of.
And Dr. Nabours, this is obviously quite an event we're going through. I don't know if anyone would have thought in January of 2020 that we would be having these conversations today. This is scary for a lot of people. It's new for a lot of people. How do we get out of this? In your opinion, what's the end game?
I think probably the only solution to this would be to have a robust vaccination program where virtually the entire public gets vaccinated. You know, if you look in years past, when I was a child, polio was a big scare, you know, and there was still smallpox around in isolated places. We don't see those things anymore because the government sponsored a very vigorous vaccination program. Nobody questioned it that I ever heard of. We all just went, got in line and got vaccinated. And those diseases are virtually eradicated because of the success of a public health program to vaccinate the public. And we're going to need something that succeeds in that way. And we've got to have people on board to do that.
Dr. Nabours, again, just talking about the seriousness of this. For those who still maybe do think it's a little exaggerated, have you seen anything like this in your lifetime?
Nobody alive has ever seen anything like this, Nick. We see epidemics of, viral illnesses and other things over the years. And of course, other places in the world have their own separate epidemics. But nobody has ever seen a pandemic of this magnitude in our lifetime. The last one that I'm aware of was the flu epidemic at the end of World War I, 100 years ago.
Yes, sir. All right, Dr. Nabours, we were to the point, and that's what I was hoping to achieve. I've really been trying to allow the local medical community to speak for themselves. And I admit that people are tired of hearing from politicians on this topic. So I appreciate you coming in and saying a few words to us today. Thank you.
Thank you, Nick. I just hope we can get people to get on board.
Amen. Thanks, Doc.
Yeah. You have a good day.
You too.